We're accounting for our responders and our healthcare workers and all our essential city employees that are out there in this COVID fight. I want to thank my Facebook friends for joining us for tonight's program. And I want to thank our participants, our panelists who are here. Let me first introduce Eric Golnick. Eric is the CEO and he's a veteran. So he's the CEO of Veteran First Responders Healthcare, which is a nonprofit organization that helps both veterans and first responders in their accessing health information from doctors and also mental health, access to mental health care. So Eric, if you could just introduce yourself and let our listeners know what type of work you're doing out there.
Absolutely. So thank you so much for having me on, first of all. And Eric Golnick, I'm a former naval officer, and I started Veteran First Responder Healthcare to help veterans, first responders, and their families with mental health and substance use issues. And in particular, we concentrate on trauma and dealing with trauma. So I'm really happy to be here.
I'm happy to have you on the program. We have Dr. Bindu Babu, who's on our program last week. She's an integrative medicine physician and ambassador and humanitarian and life coach, and we welcome her back. Would you like to say hello and introduce yourself again for the viewers who didn't have a chance to hear from you last week?
Sure. I did integrative physician. I have done my PhD. I'm also a medical physician, and I do a lot of humanitarian work, but I do focus mostly on mental health. And this is a time where there are so many different aspects of this pandemic that's hit us really in the heart and in our mind. The fears, the panics, just staying home, our lifestyle changes, our routines, and that causes a lot of shift in our mental thinking, and it's a tough time. So thank you for having me, Elizabeth.
Thanks for being back on. Thank you, Dr. Bindu Babu. Thank you. Vincent Varielli, president of the Uniform EMS Workers who work for FDNY, who are first responders, they're paramedics and EMTs. We have over 4,000 who are out there. I know your union represents the officers, which are like the managers. Thank you so much for the work you're doing out there in our front line, responding in our community and helping people get to the hospital when they need the emergency care.
Thank you. Thank you, Elizabeth. Thank you for having me on the show. I've been with the fire department EMS, beginning with the Health and Hospitals Corporation and then with the fire department over 25 years. And I've been an EMT for almost 30 years. And as you said, I represent the EMS lieutenants and captains of the New York City Fire Department. And it's a total of 4,500 members in the EMS Bureau. Thank you for having me on.
And Vinny, we understand that you are a survivor of COVID, that you had the illness in March. And do you feel like you're 100% back to your old self?
Yes, thank you. I feel I'm 100% definitely fully recovered. I got it early on. It put me out for about 2 weeks, at least 2 weeks, maybe a little bit more. I got to tell you, I could see why somebody with underlying conditions or the breathing problems or heart problems, how it can really negatively impact them. It really does make it difficult to breathe. And a couple of times it got me some coughing spells with really, and I'm perfectly healthy. I have no medical conditions at all. But I had sometimes at night, especially, it was difficult to breathe. But I'm glad I'm over that and doing much better.
And how many days were you out of work? Did you stay home?
Just about 2 weeks, maybe a little bit more. The worst days, I'd say, were 4 or 5 days that were really bad. I had a high fever and I went to coughing fits and night sweats. That sometimes at night I was afraid to sleep in the bed. I sat up in a chair because I had difficulty breathing at times. So maybe a little nervous to lay down.
That's scary.
Yeah,
Yes.
yeah.
I'd just like to give everyone an update. The governor announced today that 6 states, Connecticut, Delaware, New Jersey, Pennsylvania, Rhode Island, and New York will form a working group to develop a plan to reopen the region. The 6 states represent over 300,000 cases of COVID and sadly 14,000 deaths. 60% of the country's total. And in the past 24 hours, our death toll, we exceeded over 10,000 to date from this awful virus, and 671 people have died just in the 24 hours. So, Vinny, you seem to have had a mild case, although I'm sure to you it didn't seem mild if it kept you up in the middle of the night. But I have to imagine the type of work that Eric does, first accessing information like, do I need to go to the hospital, or like the healthcare information, or just when you're recovering. I understand it could be a very complicated process. And so while Vinny may not be experiencing post-traumatic stress syndrome, not only are people who have suffered from COVID starting to experience the stress, I'd like to talk a little bit about that, and then talk about what's available to our emergency first responders who are feeling this. So Eric, if you could get into that work that you do with the First Responder Healthcare Network.
Yeah, absolutely. And you know, from our perspective, I'm just a little background on myself. My last deployment, I am suffering from post-traumatic stress disorder. So I've been through this. I did disaster relief in Japan during the tsunami. I was on the 2014 Ebola planning team. So I've worked in this, you know, I've seen this quite a bit. And the issues we're seeing with folks, it's the short-term and the long-term effects, right? There's the short-term stress, there's the short-term anxiety. If that doesn't get addressed, and a lot of folks just don't have time, right, on the front lines, that's when you're going to see it turning into the more traditional post-traumatic stress disorder. And I think that's going to be coming, unfortunately, soon after this. Now, in terms of accessing, right now, we're offering national telemedicine, right, teletherapy for folks. And that's the best thing we can do is offer 15 minutes to 2 hours to anybody. And there's a lot of folks doing this, right? I think this is really important to be able to get people help just to talk as soon as possible.
And Eric, who qualifies? Do you have to be a veteran, or if you're an EMS worker in New York City, or like Dr. Bindu, if you're a nurse or first responder?
All of the above. Anybody that is on the front lines of this crisis right now. That is who we're trying to see and help right now. So everybody, I got a call from one of the major transit unions down south, and they were saying, look, you know, we're going out there and we're running our buses, we're running and we have hardly any PPE, and we're scared. Our guys and gals are getting very scared right now. So
we're going to get into that too. I want to ask Vinny about that, but before we get to that, I want to ask Dr. Bindu, Doctor, like, I'm understanding that there are victims that are going through this for nearly a month. Like, they could have a fever for 23 days and persistent breathing issues. At what point do you think one would need to know that they're in a stressful situation, that they could use someone to talk to, such as a healthcare professional, not just about their physical health, but also about their mental health? At what point is it time?
You know, at this point, time is now for everybody. Really, time is now for everybody. Whether you are COVID positive or COVID negative, this has impacted every person in a different way or different form. Either they themselves are going through a physical COVID positive and they're going through the disease process, or there's a loved one who has someone that's going through the disease process. There's a neighbor, there's the newspapers, we see the first responders, then generally it's fear-stricken. I mean, just personally myself, and I do meditation, I do this on a daily basis. I went into the grocery store today after a very long time, and it's very upsetting just to see that I'd have to wear this mask, I have to wear a glove, everyone around me is doing the same, and everyone is fear-stricken. And that really takes impact. You're talking about simple grocery shopping, you know, going and buying an apple, and I can't think twice without, who's next to me, who's going to breathe on me, who's going to, I at least, thank you God, like I don't think as much as, because I am a medical professional where I am aware of the virus and what it does. And I understand it's not a living being. I understand the replications and so forth, but we're talking about layman here who's maybe not in this field, and they're experiencing this and they don't understand, and right now with the media, there's no particular guideline. Everyone's washing their hands, everyone's, make sure you wear the mask, or even that just came recently, put the gloves on. Everyone knows these steps, but they're still seeing these numbers.
Right.
So everyone needs to go get help.
Right. I think it's tough, especially for our tough guys, so to say, our first responders, our paramedics.
We're the worst.
Yeah. When do you realize you need help? When do your members?
We're the worst. I mean, my wife could tell you, I was stubborn through the whole thing, the whole process. I refused even in the beginning to accept the fact that I was getting sick. And right when I finally felt sick, and then I had a fever. That's when I realized I'm out. I'm done. But we're the worst people there. We know, like you said, it's not so much about a big tough guy. We're always used to being the help. So it's hard for us to acknowledge that we now need help. And I'm very concerned. We're talking about mental health. I'm very concerned that now, because the crisis is so much involved in it, we're so much involved in it and working our job, that everybody's, occupied with it, and nobody's taking a moment to think about anything yet. But I agree 100% what Eric was saying, that when this is over, this starts to really slow down and people start to stop and think, we're going to have a lot of members, a lot of first responders, a lot of frontline people that are going to need mental health. They're going to be suffering from PTSD from this. Especially EMS in particular, we have a very young workforce. 68% has less than 3 years on the job. 75% have less than 5 years. So the amount of death and call volume they've gone through, it was like a battlefield. It's like a war out there. Right. Our cardiac arrest rates normally were about 80 times a day throughout the city. With the COVID-19 crisis, we were experiencing cardiac arrest at 300 times a day. Yeah. That's a huge increase, and that's a lot of death for people to witness. And we're used to dealing with horrific situations and times of tragedy. But for the old timers, we may be hardened a little bit. Maybe we can handle a little bit better. But like I said, we have a very young workforce, very inexperienced workforce, and this is going to really affect them in some way.
Absolutely, Vinny. Thank you so much for what your members are doing. I know a few hundred have had the experience that you experienced of getting COVID, and now everybody who's working these long shifts. Sometimes I met with many of your members last week, and they told me they're working, at that point, they were working 16-hour shifts.
4 or 5 days a week, 16 hours a day. Yeah. I'm happy. I just found out right before we started that the fire department is going to move to a 12-hour tour, which I believe both unions believe will be some sort of relief for our members. The way the schedule is structured, it'll provide a little more downtime for members to get to recuperate. Working 4 or 5 days a week, 16, 17 hours a day takes a lot out of you, and it brings down your immune system. A lot of these members, they were afraid to go home after working so many hours. They were sleeping in their cars. Yeah. Because they didn't want to bring this home to their spouses and their children. And we tried the EMS FDNY Help Fund, contributed and paid for some members to stay in hotels. Also, the FDNY also eventually came around and provided some hotel rooms for them to stay in. But this has been tough for us. There's very poor planning. Nobody seemed to be prepared. And our frontline members are the ones who paid the price for this.
Dr. Bindu Babu, can you talk about the testing? Now, there are two different types of testing. First, to see if you have COVID, and second, to see if you have the antibodies.
Well, there's the testing for the COVID positive, which they generally do in the hospital and all the testing sites. Now, the antibody testing is really plasmapheresis, which is done to get antibodies from a person who was already COVID positive and to help for treatment. But at this moment, they're still working on antibody testing for the future to see whether you have COVID positive or not? Were you ever exposed? Because there's a lot of people who were asymptomatic that might have been COVID positive, but they don't know. And that was one of the main reasons why we had such a strong spread. So that still is in development. They haven't started that yet. Right now, we're just right in the peak. I think from what I'm understanding, the government officials are really trying to wrap this together first before they can really implement, because that has a lot to do with reopening the country too.
Yep.
Yes, the governor had said that he would like to do this type of testing so people could get back to work.
Right.
You know, he didn't say that he was rolling it out this week, but he called on the federal government to mandate that these tests be rapidly created.
Right.
So, Vinny, did you have a test? Did you have a COVID test? Have you had a plasma test?
When I was sick, the testing was almost impossible to get done. Even today, it's still not that easy. Recently now, they've created a policy where if you're symptomatic, the department will help you find a testing site. But again, like the doctor said, there's many people out there that are asymptomatic. Right. And, not only do you have to worry about taking this home to your family, if I'm asymptomatic and I'm treating patients and they have an underlying condition, I'm endangering them. I could be hurting them when I'm trying to help them. So testing, to answer your question, though, it's been very difficult to get that done. And I think before we open up the city, I think that has to be addressed and accomplished. There has to be testing available for everybody so we can identify who is sick and who is not. And there also should be a test for antibodies, because I think we need to find out if people were exposed and if that antibodies can be helpful to anyone.
So I just wanted to say that plasma testing is for treatment purposes only. Right. Okay, it's not for preventative, it's treatment. So what they're doing is they're taking people who's gotten COVID and taking their antibodies out from their blood and giving it to other patients who have COVID and are in extreme states, hoping that that would help heal them.
Right.
And also, it seems like it's you are no longer contagious if you've had it, or you're not susceptible, not susceptible to getting it again. So therefore, you're cured, and you could go back to work, let's say.
Well, that's different. That's another type of antibody testing, which is what they're working on. Okay, and that's a different thing altogether. That's antibody testing on everybody to check whether you've been exposed to COVID or not. So they want to see if you have basically the military in your blood to fight this virus. That's really what they're looking for. Do you have this military? So that's kind of like whether reinfection is still up in the air. They don't know yet. There's studies in South Korea saying there's about 60 or something cases that are reinfection, but then they're not sure if it's just the virus that's already been there that's just coming out again after like 5 or 6 days. So maybe it's not a reinfection. It could be something that was dormant, like it stays in your body, like they do the same thing that happens with chickenpox. Like after years, it stays in your body and you get the shingles. So they don't know yet. Everything is still kind of out there about reinfection. But I think right now what the focus I think we should do, and I agree with the governor, is let's get this in control and somehow help the people today. And then we can somehow, with the antibody testing and whatever they're deciding to do, open back up.
Right. It must be very scary if you had it and you just don't know what the long-term implications can be for your health. And that is just something that we're continuing to evolve as we find more information about the virus. But Eric, can you talk about what your organization is doing right now with first responders?
Yes, absolutely. So, and one thing I want to piggyback on what Vinny said, it's what he talked about is the fear about giving your potential people you're treating, right? And what we call that in the military, we call that moral injury. And that's something long-term that you're gonna have those effects that could really come back and really get you into some mental health issues, right? And what we have to do, and Dr. Babu brought it perfectly, is we have to get people help immediately. And they need to take the time to get help immediately. Even if that's 15 minutes doing some mindfulness meditation, if it's talking to a professional, we have to do it. So what we're trying to do is get master level clinicians to see a first responder within 24 hours, get them into a system, get them on a system like this, like a Zoom that's HIPAA compliant.
Oh, that's great.
And
within 24 hours.
within 24 hours, that's what we're trying to do.
How do we reach you? How does it, one of Vinny's members in need or somebody who's watching this on Facebook who's experiencing the stress and trauma, how do they get in touch with you?
So 3 ways. They can send an email to telehealth@vfrhealthcare.com. They can call 800-530-1250. Or they could go to our website, vfrhealthcare.com. Or if anything, you could reach out to me. I'll get them squared away as well. And this is no cost for first responders or anyone on the front lines whatsoever.
Can you repeat the first one? Telehealth where?
Yep, sorry. Telehealth@vfrhealthcare.com. So
Thank
Victor, yeah, Victor Foxtrot Romeo.
I'm going to share that with my members. So
Absolutely.
thank you. You give you very vital service.
Thank you. Thank you very much. And I think, I think we brought it up as well, but addressing that mental health stigma, right? You guys are more stubborn than we are as veterans. The stigma of, hey, it's okay to not be okay, right? I think we need to emphasize that folks getting help is not weakness.
Oh,
Right.
yeah. You hit it right on the money. Really, you hit it right on the money. Wow. That was profound.
And Dr. Babu, you do this type of mental health meditation or, your various ways of counseling. Can you run us through a minute of an experience like that? Just so our viewers can understand what it's like to get help. Or, let's say we're in that grocery store, like you mentioned before, and we just feel like screaming because we're waiting a long time to get in. And then when you get there, there's not the food that you had planned on purchasing because it's all gone. And then you're walking down an aisle and the social distancing is not being respected and you're afraid that you might catch something. So how could we, if we're experiencing stress brought on by COVID, how could we help ourselves cope?
Well, I think one of the first thing is breathe. You must breathe. You must I always say when you're in a situation where you feel like you're starting to lose control, either from fear, panic, or any sort of issue, anything that triggers you where you're like, okay, this is not what I was expecting. The first thing is, I always say, wherever you are, close your eyes for a minute and take 3 deep breaths. And then after that, ground yourself because it usually calms you down, right? Your hormones are going down. You're kind of like, okay, I got this. And then you start thinking of things that you have. And you have to live in gratitude. That is the first thing. And right now, when we're in that frustration, oh my God, I'm not on this line. There's a whole bunch of people who are sick and I may get sick and I can't believe this is happening. This is surreal. This is like, you get so overwhelmed that when you sit down, you're not thinking about things you have, or you always think of what you don't have, right? So we got to bring that back and mentally be like, listen, you know what? I am here, but at least there's some food here. I'm going to manage what I can. I haven't been working for a month and a half. Let me try to realize that I have some financial support, whatever it is coming through the government. It's going to be here. There are things coming my way. When you sit down and kind of think about it, listen, my family's together. I have my children at home. I'm grateful for a home. When you start thinking of different things, it grounds you. But breathing is the first exercise. That's why it's important, when you have a stability of discussion, right? When I work with my clients, it's discussion and then we do meditation. I always have a 20-minute meditation and mindfulness with them every time at the end of my sessions. It is so important for them to practice that because that mindfulness changes your perspective and your thought process towards everything in life. And that's
so important.
Yeah. So then it comes very much a little bit more at ease when you do go into that situation to breathe and kind of look at the things you have and believe and have faith in whatever God or universe that you believe in.
And maybe we'll get a session in the future with you, Dr. Babu. Maybe we could do a 10 or 15-minute meditation on Wednesday or one of these days, one of these town hall meetings that we have in the future. That'd be great.
Yeah, I would love to. It's great that, the state has put up a actual hotline for meditation, which is great. I think Headspace, they're doing great things because, a lot of people don't understand mindfulness. You know, they're too hyped up into this, but it is so curative and so preventative in your being. And this is why I kind of focused myself into this, especially now. And that's why when you asked me before, I'm like, no, you have to start this now, because just like, you know, how we got hit with everybody getting sick with the ventilators being lack of ventilators, it's going to be the same thing when this is over. And then everybody just shoots and hits and they're thinking about this. It's one big boom.
Absolutely.
And we're not just talking about people who've been COVID positive. We're talking about everybody, especially first responders, because they're making decisions of life and death also. I mean, we're not thinking about media and there's no parameters. There's the person who's sick and you're trying to save their life and you're not able to, you know, so it's tough.
Yes. Vinny, can you walk us through a day, a tour? You're saying that in the city that our EMTs are responding to over 200 to possibly 300 cardiac arrests in one day.
Wow.
Yeah, so we normally respond to 4,000 calls a day throughout the city. But during this crisis, the call volume has reached as high as almost 7,400 calls. So
Wow.
it's almost doubled. And to exacerbate the problem prior to the crisis, EMS has always been underfunded, understaffed. So we had a high call volume, an understaffed agency, and then up to 24% of EMS members got sick. So now we have even less staffing that we needed. On top of that, we noticed that the cardiac arrest rates went from 80 cardiac arrests a day throughout the city to about 300 a day, which you could see an average person or average EMT or paramedic working an 8-hour tour, probably going from having 1 or 2 cardiac arrests to now about 5 or 6 cardiac arrests in a tour. And where we saw survival rates increase at that in the past, under the current crisis, we've seen that diminish. Most of these did not make it. The crisis got so bad, they actually put out new protocols where before, if we got a pulse or if EMS didn't get a pulse, we would still transport the patient to the hospital. Now they changed the protocol where if EMS could not get back a pulse in the field, we would have to pronounce in the field. We would no longer transport to the hospital for 2 reasons. One, because the hospitals are so overwhelmed, they didn't have the resources that if EMS couldn't start your heart, they didn't have the resources to do it. Also, by transporting under this current crisis, because the hospitals are so overwhelmed and there was just no beds available, it would take an ambulance 2 hours for a turnaround time to go back into service. Now, when it was a cardiac arrest, if we didn't get your heart started in 30, 45 minutes, the ambulance would go back into service right away, and we would say, we're sorry. Just make it clear, though, EMS always did everything possible. Anything that could be done in an emergency room was being done in the person on the scene of that assignment, whether it be in the home or outside the street. So nothing was taken away from the patients. We did everything possible to save lives. But, you know, it's just these are the decisions we have to make out in the field.
Your members are absolute heroes. They are our first line of defense. They're the first ones being called into the community. It's scary. It seems that a lot of these cardiac arrests, they're calling 911 and it's often too late at that point. New Yorkers need to know to get emergency help earlier than that point.
Sure. Well, healthcare is a big problem in the city and the country. And, you know, many people don't have a doctor they can go to regularly, or they rely on urgent care centers. And like you said, they wait too long and they rely on EMS as their primary health care going to the hospital. And that's not a good way to live. That's not a good way to preserve your health.
Yeah, I know. I really appreciate you being on the program, Vinny, because you tell the truth, what's really happening. It's not that our leaders are painting a different picture, but when you're out there in the field directly, you are experiencing the trauma firsthand. You know what you brought to my attention last week was that we're not even counting those that aren't making it to the hospital. It seems that they're not being counted in this daily COVID death count. Is that still happening? The mayor actually acknowledged it, and the New York Times acknowledged it.
Yes.
After you brought it to the attention, we had a program on it, so we helped build the attention. But I did see a response from major publication talking about it afterwards.
That is, to the best of my knowledge, is still happening. And that's a good point because, like I said, the cardiac arrest rates went from 80 to 300. So you have to assume the correlation is the COVID-19 crisis, and many of those patients are COVID-19, I would assume. But the only way you're going to find out if somebody does an autopsy, and with so many bodies happening at such a short period of time, I don't know if that's ever going to happen. So I don't really know if we're ever going to find out how many people died, an actual accurate number of who died from coronavirus.
Right. And Dr. Bindu Babu, maybe you could speak to this too. We're hearing that maybe the first case wasn't March 1st. For so many of us in New York to have it, there has been reports in media that this is probably and was probably going around earlier. I'd like to see how that cardiac arrest number climbed from 80 to 300. Was it going up in February? Did we see, was COVID happening in our communities and we didn't even know about it? Is it possible?
Oh, 100%. 100%, because you're talking about, first of all, we're not used to having a virus that kills thousands of people in the United States, and we're not. It's something to acknowledge that we can actually have something like this happen, and then you're talking about a virus that really doesn't have any parameters. Its incubation period is about maybe 7 days. You have absolutely no symptoms, and when you do finally show a symptom, you're in the most severe state where you're going to die. So you're having people who most probably either traveled or they didn't know they had it. They were in the subways, and we're talking about a subway. I mean, a person that's asymptomatic, positive, coughs in Grand Central, that thing is alive for 3 hours. And we know
that's the scary part, because we're hearing lots of complaints even now on Facebook as we're streaming this from viewers who have to take the train because they're emergency workers, and that they're crowded. And it's so scary out there. And even we're getting complaints that grocery store workers are not wearing protective face wear. But the governor and the mayor said that employees must be given this protective equipment so that they're not only protecting themselves, but protecting the people.
Well, you have to think today's April 16th, 15th?
13th.
We had our first case March 1st. We're talking about a month and a half of people not wearing anything to cover their mouth or face. And if they're asymptomatic, they're walking around. And we're talking about CDC, who said not to wear it initially. So there was a lot of different information from WHO, CDC, what is right, what is wrong with the people. And then media got in. So do we wear a mask? Do we not wear a mask? Well, maybe I shouldn't wear a mask because the healthcare professionals need it. But then we are United States. Why can't we provide that in 1 week? Everybody didn't get their, PPEs till like almost 3 to 4 weeks later after the first case, which was March 1st. So there's a whole bunch of different mismanagements, understandings. I mean, CDC is one of the most powerful, healthcare decision makers out there. And if they're telling you, the US surgeon saying, do not wear a face mask, it's very difficult for someone like me who may be understanding the viral, spread to tell anybody, don't listen to the CDC, please cover your mouth.
Right. Absolutely.
And then finally they retracted this and they said, well, if you can, just cover something. I mean, they told physicians and EMS in the beginning, because we don't have PPEs, to put a bandana around our mouth. So, I mean, it was a very tough time. So sure, I mean, if you're asking me if there was spread, absolutely.
What is the situation, Vinny, with your members and the PPE?
Well, everything the doctor said, Dr. Babu said was correct. In the beginning, we were wearing N95 masks to all calls. Then they started to ration us. And they said it's the CDC guidelines, and from now on, you only need to wear N95 masks only at major exposures like cardiac arrest or when dealing with respiratory ailments or procedures. And you didn't need to wear it at regular calls, or even if you knew the person had COVID-19, you didn't have to wear it. You could wear a surgical mask. And all the EMS unions really got upset over that. We told them that we are telling our members they should wear the N95 mask anytime they need to feel safe. And if our members are disciplined over it, we will defend them vigorously over it. And then the department said, well, the CDC says it's okay. We know what a government agency like the CDC will scale back just to make it fit with the inventory we have. I remember on 9/11, and I told the fire department, shame on them for trying to say the CDC says it's okay. Because I remember on 9/11 when the government agency called the EPA said, don't worry, the air is fine. You can breathe it. And 20 years later, I'm still burying friends and coworkers with cancer. So that we were not going to have that. We told our members, if you go to a broken ankle and you're talking to that person or you're in their home, you don't know if that person or anybody else in that home has coronavirus. And I would assume with the large amount of people that have coronavirus, there's somebody there with coronavirus. So I suggest to all our members to wear the N95 mask anytime they go to a call.
They are so lucky to have you, honest, hardworking leader that is advocating for them. You know, I am still shocked that your members are not getting the tests. I'm calling on the fire department of the city of New York. How do your members know if they've not, you know, they could be spreading it, unfortunately, to patients and hospital staff?
We have asked for testing from the very beginning. We thought that was the most important thing because, like we said, if you're asymptomatic and you go to somebody's home, you're endangering their life as well. Let me tell you something else. I don't buy this argument when I hear management say, who knew this was going to happen? Nobody saw this coming. It was so late. We had these conversations years ago. In 2009, 2010, we had labor management meetings. I was there when they were worried that the H1N1 was going to be what coronavirus is today. And back then, we discussed the lack of space for quarantine to quarantine our members, the lack of staffing, that they said the firefighters would have to go on the ambulances, what they're saying right now, because we don't have enough staffing, the lack of N95 masks back then. This is 9-10 years ago we talked about it. And then we had a conversation about it in February and in January of this year about it. And yet they still ignored everything that we said and went along doing it. This is a failure on them. And for them to put it on first responders and healthcare workers is just wrong. You're risking our health because you failed to lead and you failed to provide the protection that was needed to do the job. And that should not result in healthcare workers and first responders risking their lives or putting their lives in danger. I accept the risk of doing the job. I know it's a risky job, but I accepted that risk knowing that you were going to give me the supplies and protection I needed to do that job. I wouldn't send a firefighter into a burning building without bunker gear and air. You shouldn't be sending me in without a mask and gloves.
Right. And then to top it off, Eric, I would like your opinion on this, but our EMTs are not making near the amount of money our other emergency responders are making. If they die when they're at work or catch, you know, COVID and then later die, they don't get lifetime benefits that our veterans get, or even our other police officers, firefighters, first responders. They, in many ways, and Vinny, correct me if I'm wrong here, but feel like they're treated like second-class uniform services. And now they are there being exposed. And this is part of the reason that they'll need the mental health, because they're not being respected.
And I think it's going to be up to folks, I'm not to put pressure on you, Vinny, to make sure that your leadership is putting the emphasis on mental health treatment and making sure that they're getting the help that they need.
Absolutely.
And it's, you hear it from every EMT, EMS service, they are treated very poorly by a lot of, it is, I mean, I'm sorry. And,
True.
And it, you know, I think this crisis has shown that you guys are the front lines, right? I mean, at the end of the day, this is you are the first wave of people that come in to help, right?
We're the canary in the coal mine.
Terrible to say that, right? But it's again, I think the emphasis on that mental health piece needs to be vital. It needs to get to that leadership, and they need to understand the importance of this.
Absolutely.
It's very important, because I mean, I am getting so many emails, so many text messages, like it's off the hook with the way I'm trying to respond and help everybody, people I don't even know, and I'm with phone numbers and just texting, how do I deal with this? How do I deal with that? I can't believe this has happened. And it's very simple things too, just routine life, right? I'm not used to having my spouse home all day. You know, it's upsetting, you know, people have all sorts of different questions, and it's so important. I mean, if that's, every problem is very painful and hurtful, but for EMS, they need the mental help for dealing with this kind of a load is an understatement. Yeah. Understatement. especially when you're telling me, like, I didn't know, like 75% or it was just 5 years, and 35%. That's very, young experience.
I can give you a better statistic. Studies have shown the level of the survival rates increase and positive patient outcomes increase with the level of experience of the EMT or paramedic. Those who have 6 or 7 years of experience, they show a higher rate of almost 25% increase in survival rates and in cardiac arrest survival rates and a positive patient outcome. So in New York City, since they've completely ignored this and they did not address a retention problem, a serious retention problem that we have, 75% of the workforce has 5 years experience. 68% has 3 years experience. What does that do now with the current protocol that you respond to 300 cardiac arrests a day and only the person showing up at your doorstep who's probably dedicated, committed. I'm not taking that from anybody, but they have 3 years experience. So according to this research studies, what does that say? That the patient's chances of survival have at least lowered by 25%. So they've actually created a workforce that's killing people.
I'm proud to have been the chair of the fire committee when I was on the New York City Council, and I worked closely with the EMS unions.
Yes.
And each year I would fight for, and we would get more tours, right? So we would increase the size of the department, but at their same rate, they're responding to more emergencies than ever before. And we grew as a city, and our city is aging population, so more demand has been put on. In Queens, we have the highest response times in the whole entire city. If you have a cardiac arrest, which is a life-threatening emergency, you don't have 9.5 minutes to wait for EMT. And it's not like they're rushing to get there. It's just that our coverage is so sparse. And then when you have a situation like this, it makes it matters all that much more worse. And it highlights the need that we really not only need to respect our EMTs and paramedics and give them better pay and better working conditions, we need to expand this part of the fire department for New Yorkers, for our safety.
I remember when you were the chairman, Elizabeth, and you did a fantastic job. I remember specifically when you put enough pressure to get money put in the budget, and they hired an additional 24 lieutenants. And I forget the amount of ambulances, but there was a lot. It had to be like 30 ambulances or 35 ambulances that they added to the city in general. And I got to tell you, that really saved a lot of lives, and that helped a lot of people. And we're grateful for your leadership in that committee. And you did a wonderful job for it.
Well, we have a lot of work to do, and this pandemic has highlighted the need. Queens, we don't want to be known for being the epicenter. We don't want to be known as being not prepared, not having enough hospital beds, and having the worst response times. Our residents deserve better, and your members deserve better treatment too. Eric, we got a question. We want to give the viewers your contact information again in case an emergency worker needs to reach out.
Sure, absolutely. It's telehealth, TELE health at vfrhealthcare.com.
Great. And we're going to post that on the Facebook page after we finish up this evening. I'm really grateful for our guests, for you guys being on today. I would like, if there's something that we didn't talk about you think is important to get out, we'll start with you, Eric.
Well, I think just, again, my concern for these populations, especially first responders, is the mental health crisis to come. Once we get control of COVID, really understanding that, and Dr. Babu brought it up perfectly, there is going to be a need for us to talk about mental health and to destigmatize. So I think that's just want to reemphasize that. Right.
We're all going through a tough time now, but our responders, I can't imagine the stress that they're feeling, and don't be afraid to ask for help.
Absolutely.
We could all use it. At one point in our life, we're human, and the service is there to help us. Let's take advantage of it.
Absolutely.
Any last thoughts, Dr. Bindu Babu?
I do want to mention one thing really quick, was that, PTSD, post-traumatic stress disorder, a lot of people relate that to just the military. But post-traumatic stress disorder is to anybody who's gone through some sort of trauma and they get triggered by it. So this situation is extreme. And this is not just for first responders. Like I said, it's for everyone who is going through the situation. And, you know, don't look at it as weakness. It's always helping yourself to become stronger again, to rebuild yourself again, and to go back into this world in a difference, because we're not going to go back into the same lifestyle again. We're not. It's going to be different. It's going to be changed, but it's going to be better. You know,
it has to be better.
It has to be. It will be, because even the healthcare system, I mean, we just completely exposed it. I mean, we're in the United States of America. This is not supposed to happen. Okay, we spend trillions of dollars on military. We have one of the best healthcare systems. This is unbelievable, and I'm sure there's going to be a revamp of all these things. But back to what I was saying was the PTSD is very important, and this is, I'm going to emphasize something which is a little bit more in my department, is about women. Women are, there's a high incidence of domestic violence right now going on. It's taking place due to this quarantine, and it's really important that you reach out to all these mental health phone numbers and reach out for, you need mental help. You need mental help. Everyone needs it. Everyone needs someone to speak to. It can prevent a lot of times, because it's not easy for, you know, people who are going through domestic violence to just leave during this Corona time. So these things are qualities where someone can speak to you or talk to you and make you understand and reprogram your mindset and heal and do mindfulness and meditation and take advantage of all the things that are out there right now. And don't look at it as, you can't do this. Don't wait for later. Please do this now.
Absolutely. Dr. Babu, you said it right. We have to come out of this better. We'll never be the same. Too many of us have lost loved ones or have gone through the stress, such as your members, Vinny, of responding, and yourself, doctors, Eric and Dr. Bindu. You are our heroes out there, and you're doing great work. But yeah, you're not going to be the same. None of us are going to be the same. And we have to be committed to being better. As we rebuild this economy, it has to be a better economy that takes care of all of us and doesn't leave behind people who've been left behind in the past. And that we must build a much better healthcare system, certainly here in Queens and throughout New York City. Vinny, any closing thoughts? And also, like, is it letting up? The governor has said that there have been fewer people admitted into the ICU, fewer into the hospital. Are you seeing fewer calls yet?
Yes, I'm happy to say there is some good news. So like I said, the highest call volume we reached was about 7,400, but it has been going down. We were sticking around 6,500 for a while, and now it went down to 5,200. And last night, I believe we got as low as 4,800. The cardiac arrest is still a little high, but we are down below 200 a day. I believe it's like 180 now. So we are seeing signs of hopefully it continues, and it continues to go down. It doesn't spike back up, and we are seeing signs of it getting better and better out there. So we'll hope it works that way. Just to add what's already been said, PTSD I think is going to be a big issue. I think mental health is going to be very important. I appreciate one of our members, the work she does. EMS Lieutenant Joy Garcia. She does meditation with our members every day, and she does it through Zoom, which we're all getting tech savvy now with all this thing going on, everything going on right now. So she's doing a great job, though. I think it's very important. And I also want to acknowledge again, I mentioned them before, the EMS FDNY Help Fund. Many people have donated to the fund, and that fund has helped our EMS, EMTs, and paramedic members. And if anybody wants to continue helping, they can donate at www.emsfdnyhelpfund.com. We provide assistance to our members in any way possible to make it easier for them. Thank you.
Great. We'll put that up on Facebook as well. We did that last week after our visit, so I hope some of the viewers contributed.
Thank you.
And to all our participants, Vinny, Eric, Dr. Bindu, thank you so much for being on the program tonight. Thank you for the good work that you do in our communities. And we're in this together. We'll get through this together. And that's how we are. That's us. That's us New Yorkers. So thank you. Thank you so much for the work you do and being a part of this program tonight.
Thank you.
Thank you for
having us.
All right. Hope to see you again soon. Stay in touch, please.
taking care.
Have a good night. Be safe.
You too.
Night,
Bye-bye.
everybody.
Thanks. Bye. Bye-bye.